Across the country, classes are being canceled or going to distance learning again as COVID cases rise. Schools are trying hard to stay open despite staffing shortages. Districts in places like upstate New York are now asking young alumni to come fill in as substitute teachers. Subs are really hard to find. A district outside of Austin, Texas, even reached out to parents to fill in and teach classes. It's a similar story here in Western Washington. Several schools and an entire school district are sending kids home to remote learning once again. A lot of parents are feeling anxious because there's a lot of uncertainty about whether their child's school will be next. State and federal leaders are facing pressure to tackle this problem. Joining us now is Washington Congresswoman Kim Schrier. She represents Washington's 8th District and also has a background as a pediatrician. Representative Schrier, good morning.
Good morning. Great to see you.
Good to have you on the show. Let's start with some news just out this morning. The Biden administration announcing today that it will be providing 10 million COVID-19 tests every month to schools. Half of them will be rapid response tests. The other half will be PCR tests available through the Department of Health and Human Services. You have been pushing for a while to make these rapid tests more accessible, more affordable. You have been saying that they're too hard to find and they're too expensive. So this is a great move, although just a small fraction of what schools need. Do you think the administration is doing enough right now to help students and staff stay in the classroom? And we're at the peak of the surge right now, and tests are now just going to be coming out to these schools.
Well, that's a big question. There's a lot of ways to think about this. I mean, first, let me just be clear that our schools should be open. I pushed hard to get our teachers vaccinated first, so they are protected. Children can now be protected to the point where if they get COVID, it's really just, it's like a flu and it's an inconvenience, and we don't want them to be part of the chain of spreading this, but the safest place for them is in school. We know how to keep children safe there with masks and ventilation and vaccination. But let me also say regarding rapid tests that the ideal way to use those is to have them available everywhere for less than $1. Have them cheap or free so that you could use them every day or every other day just to make sure you're safe to be out and about in school. And so 10 million is great and it's a step in the right direction, but it's not enough, especially for me, because I've been pushing for this for a year and a half or so, both administrations.
Let me get back to that first part of your answer about trying to keep these schools open. I think a lot of people would agree with you that it's best for students to be in class and having in-person instruction. But when we're talking about the number of students getting COVID, the number of teachers and staff having to quarantine because of it as well, there just isn't enough people in the classroom to actually have in-person instruction. What do you suggest or recommend that schools do in that situation?
Well, that's exactly the problem, right? Nobody wants to close schools for policy. We know we don't have to do that. But even in my son's school, there are some teachers out, there's kids out, and that's not a big surprise. Again, I would say, you know, one of the big benefits of being vaccinated is that you don't have to quarantine. And so even if a child in one of my son's 6 classes is diagnosed with COVID, he still goes. We have test to stay programs so people can continue to go to school even if they're exposed. We need to do everything possible to keep schools open. That said,
yeah, go ahead.
If staff is out, we need, you know, that is the big consideration, is if everybody gets sick at the same time, whether that's in schools or hospitals, we've got a big problem on our hands.
Let me ask you, since you have a background as a pediatrician, the number of kids, specifically in the 5 to 11 age group, that are getting vaccinated is pretty low across the country and as well as here in Washington State. A lot of parents really still on the fence about whether or not to vaccinate their kids. What do you say as a pediatrician about parents who might be concerned about having a new vaccine and having their kids be vaccinated at this time?
Thank you for asking that question. You know, as a pediatrician and a mom, I'm going to answer that question. First of all, it's no longer a new vaccine. This vaccine has now been around for well over a year. It has been tried and tested in hundreds of millions of people. So that's number one. Number two is for people who are thinking about risk benefit, there's no zero risk situation here. You're either choosing a vaccine, which will allow your child to be safe, to not get hospitalized, to not have to quarantine, to be able to be with other people, or you're choosing a disease. And we know that disease can potentially cause long COVID and severe illness in children. And so as parents are weighing the risks and benefits, the decision is not between vaccine and no vaccine. The decision is between vaccine and disease. And of course, go talk with your pediatrician. You trust them.
Representative Kim Schrier, always great to talk with you here on King 5 Mornings. Thanks for joining us.
Thank you.